Case 5 Parkinson's disease. Nursing history. Past medical history. Mr. M reports a tremor of his right hand over the last 10 months. The tremor comes and goes, and more recently, it has been harder to hide. It is clearly worse when he is nervous and disappears when he sleeps. He had a right knee arthroscopy 15 years ago for a small meniscus tear. Mr. M's medical history includes hypertension for a decade. He denies difficulty falling asleep. However, his wife reports restlessness of sleep with some thrashing of arms, which has been happening for years. 11 months ago, a precancerous polyp was removed during a routine colonoscopy. MRI performed 2 months ago showed no atrophy, no enlargement of ventricles, and a few small areas of increased T2 signal bilaterally and corona radiate. Mr. M has no history of smoking cigarettes and drinks an occasional beer, 1 to 2 per month. Present medical history. Mr. M is now teaching mathematics at the Tarlac State University 2 evenings per week. He states that he has no significant difficulty performing his job, however, he feels anxious when his tremor is present. A report of his most recent visit to their family physician includes a normal physical examination, except for the presence of the hand tremor. Mr. M is sexually active with his wife and has occasional erectile dysfunction. His medications include losartan, 50 mg every day, aspirin, 81 mg every day for cardiac prophylaxis, Centrum Silver, 1 every day, and tadalafil is needed. No history of metoclopramide, neuroleptics, or other dopamine-depleting agents. He reports seasonal allergies only. Assessment. Mr. M arrived at the neurology clinic with his wife. He appears well-nourished, slightly overweight, and neatly dressed. His vital signs are blood pressure of 138/76 mm of mercury, heart rate of 60 and regular. He is 5 feet 9 inches tall and weighs 197 pounds. He exhibits a moderately decreased facial expression, a decreased blink rate, and a mildly monotonous voice. His neurological examination are as follows. For the cognition, mood, behavior, alert and oriented, mini mental state exam or MMSE, 29 2/3 recall of objects, moderately anxious. For the cranial nerves, decreased sense of smell, visual fields full by confrontation, fundy normal, extraocular movements or EOM, breakdown of smooth pursuit, mild decreased up gaze, facial sensation normal, face symmetrical with tongue and palate midline, gag reflex normal, sternocleidomastoid and trapezius strength 5/5. For the motor, mild cogwheel rigidity, right upper extremity greater than left. Tremor in right hand observed at rest. Mild action tremor on nose to finger test on right side. Decreased amplitude and slowing of finger tapping on right side. Small handwriting noted. For the gait or balance, up from a chair without difficulty. Slightly stooped posture. Initiates gait without difficulty. Mild dragging of right leg on ambulation. Decreased right arm swing with tremor of right hand. Runs with ease. Good balance with recovery on pull test 2 to 3 step. For the sensory exam, normal to light touch, pinprick, vibration, and position sense. No extinction to double simultaneous stimulation. And lastly, for the reflexes, these were 2/4 and symmetrical in the upper extremities and knees and 1/4 at the ankles. Planters are downgoing. Positive Myerson sign. Based on the history and examinations, Mr. M was diagnosed to have idiopathic Parkinson's disease, and for the family history, Mr. M's mother, who lives in an assisted living facility nearby, is alive at 89 years of age and in remarkably good health. His father died of colon cancer at age 56. He has 2 younger brothers, both with mild hypertension. And he recalls a maternal aunt now deceased with significant head and voice tremors.
Created using Powtoon.